The vomer is a bone located on the midline and is related to the main bones that make up the nasal fossae and the palate. The floor of the nasal fossae consists of the palatine posteriorly and the maxillary anteriorly. These two bones form the floor of the orbit and the roof of the mouth at the same time. The medial face is formed by the nasal septum, formed by the perpendicular lamina of the ethmoid, the vomer, the palatine process of the maxilla, the septal cartilage, and in part by the nasal bones and the nasal spine of the frontal. The roof is represented by the lamina cribrosa anteriorly and the sphenoid posteriorly. The lateral face is represented anteriorly by the frontal process of the maxilla and by the lacrimal bone, posteriorly by the vertical lamina of the palatine and the sphenoid. The inferior nasal concha also participates in the formation of the lateral face of the nasal cavities. The vomer is a thin, unpaired bone of quadrangular shape that has two prominences called alae of the vomer or wings that join the sphenoid rostrum. The vomerovaginal groove is a horizontal bony groove located on the upper surface of the vaginal process of the sphenoid bone. Together with the two alae of the vomer, forms the vomerovaginal canal which transmits the sphenopalatine vessels. The palatovaginal canal, also called the pharyngeal canal, we have seen when speaking of the palatine bone as that canal situated between the sphenoid process of the palatine and the vaginal process of the sphenoid, which is deputed to transmit the pharyngeal nerve, branch of the maxillary nerve of the trigeminal, and the pharyngeal branch of the maxillary artery. Both canals open forward towards the posterior wall of the pterygopalatine fossa. The vomerine groove, which extends from the sphenoid posteriorly to the anterior premaxillary area, supports the lower edge of the septal cartilage. The anterior margin is inclined forward and also divides into two portions that articulate with the perpendicular lamina of the ethmoid, representing the nasal septum in most of its size. The posterior margin forms part of the nasal septum, while the inferior margin joins the anterior nasal spine of the maxilla.